Hello everyone, welcome back again to my channel. Okay, so in this video I'm here to enlighten you guys, to educate you guys on the preventive measures to take in order to prevent cervical cancer. So first of all, cervical cancer is the fourth leading cause of cancer death in women worldwide. But then it is the most preventable and the most treatable forms of cancers if detected on time and if managed effectively. Now, cervical cancer affects the cervix, that's the entrance to the uterus from your vagina, and then it occurs in younger people. And what are the symptoms? Well, for some people, they may actually experience minor symptoms, while in others, they may not even experience any symptoms at all. But then in its early stage, that's in cervical cancer's early stage, you experience symptoms like vaginal bleeding that may occur between periods, during menopause, or even after sex. Then you experience unusual vaginal discharge. You experience longer periods and heavier periods than the normal periods, the normal way they normally come. Then you experience pelvic pain, that's pain around the pelvic area. Now, for the advanced stage, in its advanced stage, you may actually experience back pain, swollen legs and feet, and pain as well, and then fatigue. But it doesn't mean that when you experience these symptoms, you have cervical cancer. That is why it is important that you go to the hospitals when you see all these conditions. When you see symptoms like this, go to the hospitals, have yourself checked so that you can know exactly what is happening to you. Now, what are the causes? Well, 99% of cervical cancer is caused by the genital human papilloma virus. Now, when you have sex with someone who has this infection, trust me, you are likely to have cervical cancer. If you have sex with someone that has this infection, you are likely to have cervical cancer. Then other factors may actually be a risk factor. We have smoking, you have long-term use of oral contraceptive pills, and then when you have a low immune system. These are other factors that can actually increase the risk of having cervical cancer. Now, what are the complications? Well, complications can actually be due to the drugs you take or the kind of surgeries that are performed on you. Now, let's say, okay, for smaller surgeries that has to do with your cervix, it will increase the risk of having miscarriages in future pregnancies. While for larger surgeries that have to do with you removing your fallopian tube, your uterus, as well as your ovaries, it will mean that you may not be able to give birth again. But of course, whose reports will you believe? God's reports. But then these surgeries can actually be complications in it can lead to complications. Now, what are the preventive measures? What are the things you're supposed to do to prevent cervical cancer? Number one, we have is the HPV testing. Ensure that you go to the hospital, have yourself tested of the HPV to know whether you are positive of the HPV or negative. Then ensure you carry out cervical screening. That is why it is important to always visit the hospitals, have a general checkup, go to the doctor, let them diagnose you to know in case you have it so that they can dictate it on time. Then another thing is practice sex. Practice safe sex. Yeah, in order to stop the spread of this HPV, it is important that you learn how to practice safe sex. Then the fourth thing is vaccination. Well, vaccines, the HPV vaccine should be given in the younger people so that it can enable them keep them safe and prevent the spread of this HPV. So please guys, ensure you stay safe. Go to the hospital regularly to do a checkup. So if you've not subscribed to my channel, subscribe and turn on your notification box so that when I upload another video, you won't miss it. Take care guys. Bye.